welcome back to your Feel Good Breakfast Show. It's Expresso here on S3. Thanks for joining us on this Tuesday morning. As you know, Tuesdays are all about health, and we shed some light on what happened yesterday, which marked World Contraception Day, with a focus on contraceptive knowledge and family planning. It's a global campaign held annually to shed light on birth control methods by asserting the importance of reproductive health. And contraceptives are, of course, sometimes a bit of a taboo conversation or topic in different cultures and religions. And so we would love to know from you, what is your opinion on contraceptives? You are welcome to send us those voice notes on 063 408 8863. And this morning, here to talk to us about contraception are gynecologists and obstetricians, Dr. Jason Bennett and Dr. Kate Chambers. It's great to have both of you here so early in the morning. Thanks for joining us.
Thanks for having us.
I'm excited to be here.
Let me start off with you first, Dr. Chambers. Perhaps you could address the very simple, definitive question of what exactly is contraception? When we talk about contraception, what are we referring to as a concept and an idea?
Sure. So contraception is essentially a method or a medication that helps us to prevent falling pregnant. So it helps us to plan our families, know when we're going to have our babies, prevent unwanted pregnancies, essentially. Because we all know that at the moment, with everything that's going on in the world, there's a lot of topic around it. And in South Africa, we've got freely acceptable and freely available contraception, which helps us prevent unwanted pregnancies, which then in turn helps prevent unwanted maternal morbidity and mortality.
Indeed.
So I think also it's important to say that contraception is also a very powerful tool that women have these days and that families have these days, that it gives them a little bit more control over their lives, so they can choose when to have a baby, and having a planned pregnancy is a really great thing. It has a lot of benefits.
Absolutely. Dr. Bennett, talk to me about the more common forms of contraception that are out there.
There are many different contraceptive forms. I think contraception has been around since ancient times. It's only...
How long has it been now? Since the...
Thousands of years.
Yeah.
Just different forms. But it's only kind of now in the 20th century that there are more very good ways of contraception, or good ways to prevent a pregnancy.
Yes.
And it can range from medications, it can range from devices, such as something that goes inside the uterus, an implant that goes under the skin of the arm. It can range from surgical methods, and also just sexual practices, and kind of what we call natural methods of contraception. So there's a vast array of contraceptives, and it's important to always think that not one method fits everyone, and everyone has to kind of find what fits them the best and what works for them, exactly. And so we find a lot of people come in and one contraceptive method doesn't work for them, and we change to another method. We have a whole host of methods to choose from.
Absolutely. And ironically, with all of these methods of contraception that are available to us, there's this word or this phrase that is synonymous with contraception, the pill. I mean, there are so many pills in the world that when you talk about the pill, people know exactly what it is that you're talking about. But not too often is it understood how the pill actually works. So, Dr. Chambers, can you explain that to us? Maybe Dr. Bennett?
Well, yeah, the pill, as you said, it's the pill. It is a pill that contains some chemicals, all right? And these chemicals are usually estrogen and progesterone, okay? And it has a few kind of mechanisms that it works. The main mechanism is that it stops an egg from being released from the ovary. Okay, so the sperm therefore cannot meet the egg. There are a few other mechanisms. It makes the mucus of the cervix much thicker. So that's kind of the mucus at the entrance to the uterus. So sperm kind of cannot swim easily into the cervix, like sperm swimming through mud instead of swimming through water. If that makes sense. Also, it makes the lining of the uterus thin, so a fertilized egg battles to implant into the actual uterus. So there are a few mechanisms that it works.
Yeah, and with so much efficacy and so much usage that the pill and contraceptions have, but more specifically the pill, why does it have such a negative connotation? Why does it have such a negative rap in the world?
I think it's over the years things have changed and people are becoming more conscious of the word hormones. And obviously the pill has hormones in it, so it's got estrogen and progesterone. And as people are becoming more natural and wanting to go the more natural processes, they're a bit afraid of putting exogenous or outside hormones into their bodies. What I think people need to realize is that the hormones that we use are pretty natural for your body. Your body's used to having estrogen and progesterone in it. And we would never use something that's bad for you or, dangerous for you. And there are plenty of benefits. The pill doesn't only, and I think a lot of people don't know this, but the pill doesn't only help with contraception. It also helps to treat certain conditions like polycystic ovarian syndrome, acne, so skin conditions, irregular bleeding, painful, heavy periods. So it's not only we're using it to just stop having a baby, we're using it for other methods as well.
Absolutely. So maybe that would help change the mindset a little bit when it comes to the pill. And then we'll, of course, continue our conversation on the other side of a short little break where we're going to be tackling topics like how do you decide or how do you know which is the best form of contraception for you? And of course, in the meantime, we would love to have your opinions and your conversation around this topic. Send us those voice notes on 0634088863. We'll be right back with the doctors.
It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show, Expresso. It's a Tuesday morning and we're focusing on all things health and well-being, with yesterday being World Contraception Day. And it's not just about contraception itself, but also about family planning and population management. So a lot of different aspects being addressed by this day. Now, gynecologists and obstetricians, Dr. Jason Bennett and Dr. Kate Chambers, are still with us this morning as we continue our conversation regarding contraception. We would love to hear your opinion on contraceptives. Send us your voice notes on 0634088863. Let's actually hear one of your voice notes.
Morning. I would like to ask, why does the injection make a person fat? Thank you.
Dr. Bennett seems to have gotten that question. So the question, why does the injection
make me fat?
Okay,
so that is a very common question that we receive. The injection, meaning it's called depot. There's either a 3-month injection or a 2-month injection. To start off with, they are very good forms of contraception. You only have to have an injection once every 3 months, once every 2 months, but it does make you put on weight. So they've done a few studies and they looked at other contraceptive methods, even the pill, and they said, does the pill make me put on weight? Does the Mirena, does the copper T make me put on weight? And it's actually been proven that it doesn't. We have a fancy word for it. It's called weight neutral. So those contraceptives don't, by statistics, make you put on weight. However, the only one that does is the depot.
The depot, which is the injection that
there is a bit of
Exactly.
There is a bit of genetic link to it. So some people will not put on weight at all with the depot, and that's amazing. But some people will, unfortunately, put on weight with the depot.
So it all depends on you, right?
It depends on you.
Which then leads me to the next question that we left off with from the last segment, and that is, how do you decide what is the appropriate form of contraception for you? Dr. Chambers?
So I think it's quite a tricky question, but it's one that if you sit with your doctor, whether that's your GP or gynecologist, you can go through it and look at what you want from the contraception. Like I mentioned earlier, we don't only use the pill, the Mirena, all those sorts of things for family planning. So it's what you want. So you need to know, do you want to have a pill? Are you good at taking a pill? Because a lot of people aren't good at taking pills.
Okay, because that schedule is very important.
Exactly. And if you miss a pill, you're going to have problems. Then you get scared, have I fallen pregnant, haven't I? So if you're not good at taking a pill, then you look at something like an intrauterine device or a 3-month injection or an implant. The other things to look at, are you using it to treat something else? So do you have polycystic ovarian syndrome? Do you have acne? Do you have an irregular cycle that you're trying to control? Those will then decide, do I go with an intrauterine device or do I go with a pill?
Right.
So there's lots of different things that you need to look at. The other thing that you need to consider is, when are you planning your family? So, if you're planning on having a family, if you've just got married and you want to have just a year of, fun time with your husband, traveling, doing those sorts of things, then maybe the pill's the better option. But if you're thinking 5 years, 10 years, then an intrauterine device is a better option because it's a longer acting contraception.
Right.
So sit down with your doctor, have those conversations, and we will be able to find something that works for you.
Yeah, well, great question there. We'd love to hear more from you, 0634088863. Okay, so with regards to the pill, let's delve a little bit deeper into that. Does that make it harder to conceive?
Yes, so that's a very common question that we receive a lot. We've got these women who've been on the pill since they were 15, 16 years of age, and now they are 30 or 35, and they're wanting to have a baby, and they're very worried that their fertility is going to be decreased. And the short answer is no.
Okay.
The chemicals in the pill work themselves out of your body very quickly, and hence you have to take it every day. So your cycle can get back to normal quite quickly after stopping the pill. And people are sometimes surprised at how fast they fall pregnant after stopping the pill.
Okay.
With regards to some other contraceptives, for example, the injection, that can delay return to fertility or by about 6 to 12 months.
Okay.
So it may take a little bit longer to get pregnant if you've been using an injection.
And that's something that you would have discussed with your doctor
Yes.
at the outset,
Exactly.
depending on your family planning schedule
Yeah.
when you would have...
But in the long term, contraceptives don't decrease your fertility.
Okay.
Can I just add to that? They don't in general, but if you are treating something, so for instance, if you're using the pill to treat polycystic ovarian syndrome, as soon as you take away the pill, you've still got that underlying condition. And the problem with polycystic ovarian syndrome is people don't ovulate. So if you have PCOS and you're on the pill and you stop the pill, you might struggle to fall pregnant, but not because of the pill,
Right.
but because of the underlying condition. And I think that's something that people get confused about.
Wow. Brilliant insights, doctors. Much appreciated. We'll continue our conversation. 063-408-8863. That's the number for you to send through your voice notes to as we delve a little bit deeper into this issue or this idea and conversation regarding contraception. And of course, yesterday was World Contraceptive Day, which is exactly why we're focusing on that topic on this Health Tuesday.
It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show. We continue our conversation around contraceptives on this Tuesday morning where we focus on all things health. And that's why we have gynecologists and obstetricians, Dr. Jason Bennett and Dr. Kate Chambers, who are still with us this morning. And of course, we love hearing from you. We actually have a voice note that's come through from Sue. Let's take a listen.
Good morning, Expresso family. What I would like to know on behalf of my granddaughter is why does the pill adversely affect some people and others not?
Great question, Sue. Thank you very much for that, which is actually where we are going to pick up the conversation about some of the possible side effects of the pill.
Yes, so very common question. You know, the thing is with any medication, everybody reacts differently to medication, and it's about finding one that works for you. And there are so many different types of pills on the market. All of them have different doses of estrogen, possibly different types of progesterone, and it's about finding one that suits your body. So unfortunately, you know, there isn't one that's one size fits all, and it might be a little bit of a trial and error to try and find one that works. The common side effects with the combined oral contraceptive, because of the estrogen and the progesterone, are nausea in the beginning. You can get breast tenderness because of the increased progesterone. Some people get headaches, and those are generally quite transient. They last about 2-3 months as your body is getting used to having the external hormones. Having said that, there are definitely some patients who don't respond to hormones as well as others do, and then it's very important just to go back to your GP or your gynecologist and have you rethink the conversation and look at other options. Say what your side effects are. Maybe we need to decrease the amount of estrogen, change the progesterone, and see what works for you.
Okay, so ultimately it is dependent on each patient.
Exactly.
And you need to kind of go through your own experience and
Exactly.
your doctor's there to help you out with that. Now,
Exactly.
another question.
Good on Sue for looking after her granddaughter's
Yes,
contraception.
exactly.
Exactly.
Thank you,
As
Sue.
a grandmother
I
speaking
think
on
that's
behalf
very
of the
progressive.
Yeah.
Absolutely. Well done, Sue. So
Amazing.
thank you very much for that. Now, let's quickly talk about a question that maybe, I don't know how often you get this kind of question. Taking a contraceptive, does that impact on the transmission of sexually transmitted diseases at all?
So, contraceptives in general are really good at preventing pregnancy if you take them properly.
Yes.
However, they are not good at preventing STDs or sexually transmitted infections. The only contraceptive that will prevent a sexually transmitted disease is a condom.
There we go.
So it is not a method
Simple
to prevent a
as
sexually
that.
transmitted disease.
Yeah. Let's talk about some of the health factors that might influence your choice of contraceptive and how those are categorized.
Sure. So The health implications or the certain things that we get concerned about with different types of contraception, especially with the combined oral contraceptives, so the ones that have estrogen and progesterone in them. The common things that we look at are you on any other medication? So often different psychiatric medication can interact with the levels of the pill because they're both metabolized by the liver. So you just have to see whether they will counter each other. So whether you're on other medication. The things that we get concerned about is high blood pressure, obesity or being overweight, smoking are all contraindications to being on a combined contraceptive. And especially the other thing that a lot of people talk about with the pill is clotting. So having previous clotting disorders or having had a previous deep vein thrombosis, you shouldn't be on the pill.
Right, right.
So we have what we call the WHO eligibility criteria, where you sit and we go through what your medical conditions are, and we can say, okay, this is what would work for you, this is what we avoid. But those are just the main things that we get concerned about.
Yeah, yeah. So very important that when you are considering being on a contraceptive that you have a full-on consultation with your medical expert so that you get the right one that is suitable for you. We also got some interaction and some comments from our social media pages where Lerato Mokotlo said side effects is what should be spoken about. I have different experiences with various ones I used and they're all bad. I'm yet to get something that suits me. All right, so what would you suggest to Lerato at this point? Is it about just revisiting the conversation with your particular specialist? What do you do?
Don't give up, Lerato.
Yeah.
I think that's important to say. There will be something that suits you.
Yes.
I'm not sure what you've been on, so it's going to be important to literally go step by step from the time you first started contraception, go through what worked, what didn't work, what you didn't like about the contraceptive, and kind of move on to other methods. As we said, not one contraceptive fits everyone. And there are so many these days.
Absolutely.
So there's definitely a contraceptive choice for you. So I'd say, Lerato, go back to your doctor and have a chat and just think of some other methods. Remember, there are a whole lot of non-hormonal methods of contraception that work really well, and people do very well on them.
Now, another aspect of this conversation is that of family planning, which is actually a very important part of contraceptions and why they exist in the first place. So what exactly is family planning and how is natural family planning different from contraceptions?
So,
So
family planning is, as it says, you're planning a family. So we would love you to be able to choose when you want to have a baby, so it fits in with your lifestyle.
Yes.
You're financially ready to have a baby, you're emotionally ready to have a baby, you've got a certain plan and you've reached certain goals and now it's time to have a baby. And we find that definitely helps a lot. And that's kind of family planning, and that's why we have contraception. You mentioned natural family planning.
Yes.
So it's something we can't overlook. There is something called natural family planning, where we don't use medications or devices. It consists of things like using rhythm methods, kind of sexual practices. And it does, I mean, it's not the best form of contraception, but it does work for some people. And I think we must respect that. And if that's what someone wants, and that's what makes them happy, and if that's what works for them, we must go with it.
Yeah, ultimately, this is all a choice.
Yeah, and just to add to that, I think the day of technology, the app, there's lots of apps that help us to track our cycles, which then tell you when you are ovulating and when your fertile period is. So those all help with the natural family planning. But it must be noted that obviously you can't do natural family planning when you have an irregular cycle. So as Dr. Bennett says, it's not the perfect form of contraception, but it is out there and it needs to be discussed.
In saying that we do have a lot of births from natural family.
As a result thereof. And then finally, I do have to touch on this one quickly. If there's any kind of emergency method of kind of fail-safe if your birth control fails.
So if someone's using their birth control properly, the failure rate is actually really low. That using it properly, meaning you're taking your birth control pill every day at the same time, you don't skip any days, it's less than 1% chance of failure, which is really good. I think if someone still falls pregnant and they're using things properly, then I think, as I said, it's maybe it's meant to be. I don't know. Maybe you're lucky or unlucky. But for example, if someone's not on contraception and there is some sort of accident, there are some things that we can do. It's called emergency contraception. Everyone's heard of the morning after pill. It's available at any clinic for free. It's available at any pharmacy. It doesn't need a script.
Okay.
It is a pill, but you must take it as soon as possible.
Yeah.
And the efficacy decreases rapidly. Another method is to put in a device as soon as possible. So, for example, a copper T, which is a device that goes inside the uterus, also as soon as possible, but more effective than taking those medications. And also, you've kind of sorted out your family planning for the next few years.
And rather that than be afraid of the judgment that you might get from the person across the counter.
Exactly.
Do the right thing for you. And Dr. Chambers, Dr. Bennett, thank you very much.
Thanks for having us.
Thank you for having us.
Very interesting and insightful conversation. Hopefully you enjoyed that. But please continue to engage us on social media, #Expresso.